Hello, this is my new video again. It's related to the speaking. In the speaking module, I would like to discuss about what are the things you can do or what you should not, right? The very common mistake that every students are doing is using the medical terms to the patient. When you are doing the speaking, right? When you are doing the speaking, OET speaking, you need to make sure that you are a nurse, but you should not use the medical terms to the patient. What thing difficult for the patient to understand is like a complication may not be familiar with them. Many of the medical terms are not the normal English which we are speaking every day in the usual purpose. So you cannot use that in your OET speaking. Instead of that, try to make it into the simpler. Like for example, if you are saying fasting also, they might feel like familiar with that, but they may not be familiar with what fasting is done in the hospital, especially complication if you are saying directly, or endoscopy things and procedure things. They may not be familiar with that. Sedation, maybe sedation they may be able to understand, but not the majority. So that's why every student should make sure that when you are applying or when you are going for the exam or doing the OET speaking, make sure that you are trying to use the lay term, means in a simple English rather than making it to the medical English. Okay, I'm sure you are a nurse. Everyone knows that you are a nurse, but you should not use the medical term during the speaking in the OET module. So many of the students are going to write the exam on the 9th. So I wish you a very best wishes for your exam, but I would like to advise all of you not to do that mistake in your exam, which is very common, and I'm sharing with you in the next video which will be explaining you with my students. I have conducted the class in which I have found lots of mistakes regarding using the medical terms which is not advisable in the OET, and I'm sure if you are able to manage these simple things and connect the sentence which is mentioned already in the question, I'm 100% sure that you can clear the B band without any trouble. That much, and catch you in the remaining videos which is going to explain about the detail of the OET speaking. In this one, you are using more of the medical terms, right? In everywhere is mentioned the more of the medical things. So patient may not be like a familiar, like a local anesthetic and a procedure fasting. What is a fasting may not be having a much idea, right? And why we have to do this. Complication, you are saying complication is rare, and like what is there, drowsiness is not too much, sedation, and you can say instead of sedation you can say like I'm going to make you sleep, like we are going to provide anesthesia. Okay, I think more of the patient they will understand and what is meant by anesthesia, but they don't know much about the sedation, right? And also no need to specify so much about the breakfast specifically, like individual wise coffee, tea, apple juice, no need. You can either drink tea or apple juice on the day of the endoscopy. Are you familiar with that, or are you able to follow that? Okay, got it. And pre-procedure fasting, no need to say that one. Before doing the procedure you can skip the food and drink. So how does this sound? We are going to provide this facility because to prevent don't say risks and all, to prevent, don't say aspiration also, to prevent the blockage or obstruction. Okay, obstruction or blockage into the lungs under, since we are going to make you sleep with the anesthesia which will relax all your body, so chances is there to obstruct your respiratory system. So also to ensure about the good view. Understanding, right? So like that you have to say, okay, you both are able to manage this thing well, but you are saying more of the medical terms which is not advisable. See, patient is already confirmed with the procedure endoscopy, so she is not familiar how you are managed with the introduction of yourself and patient, how are you, and everything was fine. But once you are saying about the, I would like to I am 100% sure you are not familiar with that, or you have mentioned like are you familiar with endoscopy, and patient said I don't have a knowledge. Don't be overly concerned, both of you have said, and I'm going to explain you the endoscopy, what is meant by that. And you can say endoscopy will last it. Don't say short duration. If you say around 15 minutes, you can say either 15 minutes or short duration. Okay, clear? It is for the short duration, and we will provide you the local anesthesia to make you sleep. Okay, clear? Don't say sedation provided and all. And that anesthesia will be in the spray form, which will numb your area and you will not experience much pain. Don't say discomfort and all. If you are saying about the you will not experience much pain and discomfort is same. So don't try to repeat because you are wasting your time. Okay. And now is are you able to follow me? Okay, you can say that also, or am I able to help you? Okay. So once after that, now next I would like to discuss about is preparation for the procedure. First thing, preparation is no food after the midnight. The next day of the before the surgery, that previous night, no food after the midnight. Only clear liquid. Only clear liquid. Are you able to follow this thing? That also up to 6 hours before the hand. Before hand means before the endoscopy. Okay. And then once after that, you both have asked, well, okay, current medication, are you on any present medication? No, I don't have. Thank you so much for your reply. Okay, you need to specify that also. Okay, whenever patient is giving you one information which is very helpful, you need to say thank you. You need to respond it. And then you can say emphasize need for the pre-procedure fasting. I have already said, right? You can say before doing the endoscopy, we have the procedure of keeping the food and liquid diet. That is called fasting. So why we are doing is because to prevent the risks of obstructing or blockage of the respiratory system. Okay, because things get very relaxed with the anesthesia. So in order to prevent this problem, we are encouraging you to skip the meals and liquid. Also to ensuring a good review. Okay, good view, then we can diagnose what the specific problem. And also I would like to suggest that you can have a breakfast on the day of the surgery, but breakfast will be like the apple juice or tea. No need to say black coffee and all. Okay. And do you have any other concern? So patient will say, yes nurse, I have a concern that since you have said that I'm going to have a endoscopy inside my throat, which is kind of very different experience I'm going to have. So do you think I will have a problem after the procedure? I understand your situation. It is very common problems that patients are raising for this kind of procedure. So it is very rare, this kind of problems. Instead of saying complication, you can say this kind of problems are very rare. And also the nurses will monitor you before and after the procedure. So problems are very rare. And also if you wish to have more information, that will be available from the doctor. So how does it sound? Then patient will say, yes nurse, thank you so much. Now next, I'm going to explain about the post-procedure, post-endoscopy. So do you like to hear about that? Yes nurse, I would like to hear about it. It is going to experience your mild discomfort, but not the big problem in your throat. But it will be relieved as the gradually, and need for the rest. And recovery is quick and you will get discharged within the day. So how does it sound? How are you feeling with that one? So patient will say, oh, like that. Then you can say after effects of again one more thing is, once after effect of the anesthesia, don't say sedation, anesthesia and throat spray, you may experience drowsiness. Because of that reason, I would like to request you to arrange someone to assist you during the discharge. So do you have anyone with you? Yes, my mother is. I'm so relieved that you have someone to assist you, and thank you so much. So is there any more I need to explain? No, nurse. So if there is anything, please do not hesitate to press the buzzer or let me know. I am here to help you in the any aspect. Thank you so much for your active participation. Take care, and that's all. I'm here. We are here to help you. That's all. Just stop it. Don't say many things, okay? Because once you are reaching to the stress need to arrange someone to take patient home, that time your time is about to collapse. Okay, about to finish. So you have to make sure that I should not miss the major part, like concluding. Thank you so much. Since you have a mother. Oh, I'm so relieved that you have someone to assist. Thank you so much for your active participation, and I'm very grateful that I'm able to provide you the right information. And I wish you are very effective endoscopy. You are in the right place. Thank you so much. If you want to say like this, say in that way rather than focusing on the mother part and all. Okay. So do you have a doubt?
No.
No. Kalden? Okay, that much for today, and I hope I have made the clear with every students your doubt and all. If there is any doubt related to the speaking and any part of the modules, you can leave the comment, and then you can inquire about what's your doubt, and I will make sure that you can get the right things from my YouTube. Thank you so much, and catch you in next video.